Hello, everybody, and welcome once again to Functional Medicine with me, Dr. Howard Robbins. As you know, our show is dedicated to prevention as well as a way to treat various diseases and medical problems, conditions that there is no other way of helping or has only been minimally helped using traditional allopathic medicine as safe and effective ways and natural ways of fixing these things. Today we have a show on women's health problems, specifically women's health problems like endometriosis, endometritis, fibroids on the uterus, PMS, um, all the things that women specifically suffer from, and how you can not just prevent, but how you can treat them if you have it. And most of the time, people listen to our shows when they have problems. So we're going to be talking about these things, and my two sponsors are key and amazingly important in the safe and effective, those are two important words to put together, safe and effective ways of not just preventing, but getting rid of these problems permanently, completely, once and for all. Okay, so first I want to thank Promolife.com. Promolife makes various products that would be very helpful with this. One is their basic home care machines where you would be doing rectal and vaginal insufflation, which you're going to hear about in the show. Also, they make suppositories that are very important in helping some of these diseases and conditions of the women's specific organs. So this is important. Write down their number. You're going to want to call them so they'll do something special. They'll give you a % off or something. Tell them you heard about it here on my show. And their phone number is 888 742 3404. That's 888 742 3404. I also, and you're going to learn why it's so important, you're going to want to go to doctorsbiome.com. That's doctorsbiome.com. Now, I'm going to talk more about it later, but they make a very special probiotic beverage that you absolutely positively have to take every day. And it's going to strongly affect how these problems are either prevented and or helped dramatically. And when you go there, remember to use my coupon code that I give to my patients because it's not an inexpensive product. It's a very special probiotic beverage because all the bacteria are living. They were never freeze-dried and nearly destroyed completely into a capsule, powder, or tablet form. They're all living in a 100% delicious organic juice. Now, they do have a woman's product. I don't know what they're going to change the name on the label to. The woman's product comes in a very special juice. We'll talk about it later. But either that or their gut health is perfectly perfect to take. And remember to use the coupon code Howard35, and we'll talk more about all this in a bit. So, but let me get right into this now. Women have a very special system in their body. And this system there can be affected by many different things. You have endometriosis, which is a chronic condition where the lining of the uterus grows outside the uterus onto the ovaries, the fallopian tubes, the pelvic lining, and causes all sorts of trouble. I'm not going to go into all the different symptoms of all these different things. If you're listening to this show, you know what the symptoms are. Okay. There's also endometritis, which is a more acute inflammation, often caused by infection of the lining of the uterus, the endometrium. That's usually bacterial. There's PMS, premenstrual syndrome. God, we all know what, I think almost all adults know what PMS is and how so many women suffer from this so severely. Fibroids, little benign growths that can occur on the all around and on the uterus. They're leomyomas, but basically speaking, uterine fibroids are little cysts, little growths that form there. They're not cancerous, though they may become that. It's very not common, but they have that they have that as a problem. Then there are women who suffer from irregular periods. Now, technically, a woman only needs to have one menstruation a year to supposedly be healthy. But the key is to be regular in your menstruation. Then there are women who suffer severely from menstruation, heavy bleeding, all sorts of hormonal changes that cause depression, anxiety, um, uh, can cause all sorts of troubles like that. There are other causes of these things as well. Sexually transmitted diseases like chlamydia and gonorrhea, and of course, syphilis can cause all sorts of troubles down there. HPV, we've done shows on HPV, you may want to listen to more specifically, can cause women problems down there. This show is trying to help women with all these different issues, all these different problems. And when sometimes it happens just simply because the mechanics have changed after you've become pregnant, even whether you've had miscarriage or not, or even after childbirth. Perhaps you've been using IUDs and other device, other methods of preventing pregnancy. I'm going to do a whole show on pregnancy one day and explain what's going on and why we're able to help with that as well. But know that I'll just mention it now. In our clinic, we've seen 8 women over the years come in who either became pregnant, lost the pregnancy, or couldn't become pregnant for whatever the supposed reasons were. And whatever happens with ozone, it fixed it. Okay. And uh, my wife always likes to say, without my DNA, she wants me to add that to it. Um, so they were able to become pregnant and go to term. All right. Um, so what we're finding out is that a lot of these things, some of them are hormonal issues where you're not balanced correctly in your estrogen, your progesterone, and as well as your testosterone. And of course, there's always genetics, and ozone, and what we're going to talk about isn't really going to fix that. Genetics are genetics, and nothing that we've learned can change the genes and fix the genes. A lot of these problems happen as women age. So aging seems to break things down. So if we can retard the aging process, which we can, and improve all these functions, that becomes very important and effective as well. Um, Balancing the hormones and everything become very important. And one of the most difficult things I don't do it. I work with doctors that do. Bioidentical hormone replacement therapy can be extremely important in helping many of these conditions that we're talking about. But what overall, and I know there's various vitamins, minerals, and supplements that women can take that help with this vitamin A, D, E, vitamin C. All these things are extremely important in balancing your systems out and whatnot. What we've seen is, um, I don't know, that comes different names. First, let's start with the gut uterine vaginal axis. The gut uterine axis, the gut vaginal axis. This is whereby if you don't have a healthy gut, you can't have a healthy female reproductive system. It's just that simple. You have to, in fact, the gut organ axis works with every organ and every system in your body. So you have to replenish the healthy biome in the gut, getting yeast in balance again. Many women commonly have problems there where they get frequent yeast infections. Okay. So it's important to rebalance your gut with healthy biome. And that's why I talked earlier about Doctor's Biome. Now, they were making a product, and they're still going to be making it as soon as their new labels come out, um, called Women's Health. Doctor's Biome Women's Health. It's the same bacteria they have in their gut health product. They're special strains living in a 100% organic juice. In the Woman's Health product, it's living in a 100% organic, let me get this right, watermelon, apple, beet, pomegranate, strawberry juice with added cranberry, which helps prevent urinary tract infections. All organic. Everything is organic, of course. So it's delicious. There's no added sugar, there's no fermentation, no alcohol. It's absolutely delicious. But the key is these 15 proprietary strains are living and eating the food, the prebiotic that's in the juice, naturally in the juice, so that it's growing in number every day in the juice. And then when you take it, when it's able, because it's next generation probiotics, it's able to survive the stomach over acids over 90%. Capsule, powder, and tablet probiotics are destroyed over 90% in the stomach, provided they even can come back to life out of the freeze drying process that turned the living bacteria into a powder, which they fill into a capsule, compress with other things into a tablet, or sell you the powder itself, which is mostly fillers. Because the bacteria in a whole bottle of that, in a whole cap, fits on the head of a pin. Okay, it's just the way it is. They had to make it usable. They have to add all this other stuff. Well, in any case, they may not even come. It's proven they don't come back to life. And what does is destroyed by the stomach acids over 90%. So Doctor's Biome next generation probiotics that they use in their 15 patented proprietary strains, survive the stomach acids over 90% and can stick to the wall of the gut because they also have a dual designation as being what's called smart probiotics. Can't make this up. Smart bacteria. They're capable of sticking to the wall of the gut and changing their genetic expression when they get there. And there's other reasons why. Listen to my shows on this. I don't want to get into more detail about it, except it's important to take a 2-ounce shot every day. And if you can't get the Woman's Health product, whatever name they're going to put on their new label, get the Gut Health product. It'll work just as well, okay, for you, as long as you're not getting frequent urinary tract infections. Having said that, uh, rectal insufflation ozone, and that's why I told you about home care ozone, and vaginal insufflation. What is that? It's an ozone enema and an ozone douche. Now, you always want to wet yourself first with distilled or purified water. You want the tissues there, because they're mucous membrane tissues, to be wet to begin with, so they don't get irritated by the oxygen and ozone gas. You should be using no more than a 20 microgram concentration of the gas, so that it's mostly oxygen with a small percentage of ozone in it, so you don't burn yourself or hurt yourself. Then it's done safely. We've done shows on ozone home care. You can go to promolife.com, tell them you want to get set up for home care using, a la Dr. Robbins. So they'll give you something special off on the price, or do something special for you. And then you want to do vaginal insufflation, which is an ozone douche if you have these problems, twice a day, morning and evening. You want to do, and you fill up these bags that they sell you. You put a little catheter on, which is like a thin plastic tube, size of a thermometer kind of, little holes at the end. You wet it with a little vegetable oil. That's important. Just, lubricate it with a little vegetable oil. You insert it so many inches as you can, rectally or vaginally, and then you slowly squeeze the gas in it. For vaginal insufflation, after that night before you go to bed, you want to get one of their suppositories. I would recommend the hemp oil suppositories that they make. And you insert a suppository, and the women that I know have told me that you should use a light panty liner so you don't mess up your bed. And you insert that when you go to sleep at night. And this can help with all sorts of women's problems inside you. And when you do it, vaginal or rectal insufflation, you want to lay on your back with a couple of pillows under your buttocks. And as you squeeze the gas out of the bag, never directly from the machine, this way, being heavier than air, the gas can get farther back in vaginally as well as into your colon. In the colon, it'll get absorbed into your blood. So you're getting the benefit for your women's reproductive system from the inside out, so to speak. It's not as powerful as IV ozone therapy. There is no doubt intravenous ozone therapy and the Robbins method of direct IV, which we've done over 385,000 times over the last 30 of my 35 years doing ozone, has proven itself around the world to be the most effective way of helping with these female problems. Um, and that needs to be done at least 3 or 4 times a week. There is no doubt about it. It's medicine. And you need to take medicine not just 3 or 4 times a day like most medicine, but at least 3 or 4 times a week. Whereas the insufflations, the ozone enema and the ozone douche, you can be doing twice a day, morning and evening. Okay. And of course, doctors that I've trained around the world know how to use the Robbins protocols for these kinds of things. Um, and there is no average, typical, or usual number of treatments to fix these problems with intravenous ozone therapy. Um, there's just no way to know. Everybody always wants to say, well, in my case, I know there's no way to know, but in my case, what's the average? Well, you may feel, as I always say, your mommy always told you were special. But you're not special to ozone therapy done the way we do, the way it's done, the way we do it and teach it. It's going to work whether you believe in it or not. It's going to get rid of your problem whether you expect it will or not, because that's what it does. And to be clear, nothing is 100%. And even if we help 10,000 patients in a row with these issues, you never know what's happening on 10,001 for some reason. Um, so there's always a chance you're going to be failing. But using Robbins' method of DIV, doctors around the world have only seen in the high 90 plus percentile of success with all these medical issues that I've mentioned that women can have. Um, but there is no way to know how many treatments you're going to need. Generally speaking, it's S&S. It's safe but slow. It's going to take months to really fix all these things. The good news is sometimes women experience early improvement, and that's not surprising. Early improvement with these things. Sometimes in just a few treatments, they notice benefits. Others have had it for a very long time. They may need more treatments before they start to notice improvement. But if you stay with it and you do it consistently, which is a minimum of 3 or 4 treatments a week, while more may be better, and if you're doing home care ozone as well as taking the doctor's biome, uh, I expect you're going to win. And you don't have to suffer the rest of your life with this or deal with all the adverse effects that these things cause in your body. Whereas all the natural stuff we do gets rid of those problems. Well, if you have more questions about this, you're welcome to call my office in Manhattan at 212-581-0101. That's 212-581-0101. You can email me at ozonedoctor, OZONEDOCTOR, all spelled out, one word, at yahoo.com. Go to promolife.com, see their products, but call them at 888-742-3404. Tell them you heard about it here, and they'll do something special for you to get set up for all these things. Certainly, if you can't get IV ozone in any way, then You may just want to get to them and get started doing things. In addition, go to Doctor's Biome, and that you can do right away as well, and get Doctor's Biome at doctorsbiome.com and start taking either the gut health or the women's health product. Everybody, please subscribe to our channel. That would be wonderful and a thank you. Look at all the other shows we have. You may find you or one of your friends can benefit from them. Stay safe, stay healthy, stay well, and we'll see you soon, hopefully back here on Functional Medicine with Dr. Robbins. Bye now.